Okay, so what I want to show you in this video is how to do the lumbar sacral release in craniosacral therapy. So what is this good for? So when we're using craniosacral therapy, now, if you have no idea what craniosacral therapy is, at the end of this video, I'll have links to what is craniosacral therapy, how to feel the rhythm, all of these different types of videos. In fact, I've got a complete playlist. Right, now, so what is the lumbar sacral release good for? So think lumbar problems, pelvic misalignments, sciatica, but because of its connection from the sacrum right the way up through the cranium, so we can also affect things like sinusitis, migraines, headaches, all of these conditions as it's all connected, as you're about to find out. So in the links below, just before we get into the video, if you're really interested in craniosacral therapy, it's one of my most popular courses. I go through all of the basics to advanced through craniosacral therapy. I also look at craniomanipulative techniques, so you can have a look at the links below. I've got them at a discount at the moment, so you can have a look at that if you're interested in getting deeper into craniosacral therapy. Right, but for now, I'm going to show you how to do the lumbar sacral release and all about the releases, unwinding, still points. I'm going to introduce that, direct and indirect release, all this good stuff. Right, let's get started. All right, so the very first release we're going to do is the lumbar sacral release. It's a very common one done and very, very powerful as well. So I'm going to show you there's two positions that you can work with the client, and I'm going to show you both. Because the first one is putting your hand between their legs. Now, if that's too invasive, now I want you to get feedback from your friends, your family, whoever you're practicing on, to ask them, does that feel too invasive? So if you're working with a client, or even, and your friends, just get permission first. Explain to them, I'm going to put my hand on your sacrum, and I need to get my hand between your legs as you lift up, so I can get that. But is that okay with you? So get permission, right? And then get feedback to see if that's, because very often people are just feeling, it looks worse than it feels as a client. They're like, oh, that feels fine. Yeah, no, do it, okay? And I'll show you the alternative, which is coming in from the side as well, okay? So you're not going between the legs. Then I'm going to show you that. But first of all, what I want to do here is show you where my hands will be. So with Liam's head, or your client's head up this end, right? So you're seated at their hips, all right? Now, first thing you'll do is, if you're going to work between the legs, is to get the leg away from you, so first further away towards the camera, get them to bend their knee, and then lift up their hips so that you can slide your hand underneath and rest your forearm on the table. Your hand is cupping the sacrum, all right? What we're going to end up is with a T shape like that. So, first of all, their knee bent, get them to lift up, slide that underneath, check that they're okay, and then their leg goes back down, all right? So now you've got your hand cupping the sacrum, and the other hand, okay, so my left hand, their head's up here, will come down, and it comes right next to it on the L5 edge, so the lumbar spine. So we are at the junction here. This is on the sacrum, and this one is on your L5 region, L3, L4, L5, okay? You can just simply have that underneath the spine. If you want to, another technique is to have L5, L4, L3 spinous processes. So you can do that and have them on the spinous processes, or just have your hand flat on the lumbar spine. This is more of a stabilizing hand, right? Okay, so once you've got that, so nice and comfortable, right? So your forearms are relaxed there, and what you're doing in this position, now remember, you're just creating this healing fulcrum in this position. What are your intentions in this maneuver? What we are looking for is good movement between the sacrum, okay, so if this is your sacrum and your lumbar spine, we want movement, this good movement at this axis here of your sacrum, all right? So if this is the spine going up here, here's your sacrum, tailbone down here. If I can show you like that, this pivot point like that. So we want good movement, flexion and extension, okay? So what you're feeling for when you've got this here is feeling for the flexion of extension of the sacrum. Does it feel locked up? So there's not very much movement here. So you're feeling for it, does it feel locked up? So, and you just, at the moment, you can just sit there and just feel for the craniosacral rhythm. And I want you to just feel, does it feel locked up? So there's nothing going on here, and you're trying to feel this flexion of extension. Again, I'm exaggerating this movement, And so as you're going through there, also, once you get better and better, what I want you to do is feel, does flexion and extension, so if I've got this here, here's your sacrum, does flexion and extension, so if you just think of like that, do they feel even, or does one feel, goes like that? So if this is 12 o'clock, does it feel like it's going more in this direction and a little bit in that? As opposed to, if we look at a clock face, 12 o'clock, 2 o'clock, 10 o'clock. So if it's going 2, 10, like a pendulum would, does that feel nice and loose and even? Okay? So if not, so just for the moment, I just want you to just listen in with everything I told you at the moment and just try to feel that sensation. Can you feel the craniosacral rhythm? And if so, what is going on with that sacrum? Does it feel loose? Does it feel, it extends and flexes in a way? Because that's what we want, right? So that's what you're feeling for and hoping for more movement. When we get that therapeutic release, you want to get that from, if it feels really stuck, to getting a much better movement of the sacrum on the L5S, so L5S1, okay? So that's one thing to do. So just at the moment, feel that and just stay there and wait for a change to happen, okay? Wait for that therapeutic release, whether it's unwinding now, or whether you feel that still point, okay? So remember, you're feeling it and then suddenly there's nothing. Now this could be moments, it could be minutes, and then as the craniosacral restarts itself, you feel a shudder and it will come back stronger and you'll feel better movement as it's come back. The craniosacral, as I said to you before, will feel stronger, it'll have better harmony, and you'll feel it's reset itself, okay? That's what it's doing, okay, in the still point. As I said to you, we can initiate a still point. So how do you do that? Now, this is kind of more advanced, but I want to just touch on it for those of you who are have really got this, right? So as I said to you before, what I just talked about is still point. Intrinsically, the body, just because you've been there, you've set up a novel stimulus, a fulcrum, and what's happened is the body has then reset itself. It created a still point, stopped the rhythm, and then brought it back, and it's much better harmony, all right? Which obviously is going to have flow-on effects through the fascia, the joints, everything throughout the body, energetics, everything. So what if you wanted to, if you really went, okay, now again, this is more advanced, but I'll tell you right now. So let's say there are two ways to do this. There's direct and indirect method. Right, so what is that? So let's say you can feel the sacrum, and for argument's sake, let's say it's going this direction nicely, but it doesn't go very well that way. So there's a big imbalance. So we've got this movement going well, but this movement's very restricted, all right? So what can we do? Right, so what we can do, now remember, it's 5 grams of pressure. We're not, yanking anything like this. It's the weight of a nickel in the pressure, right? So what we can do is, let's say it goes into this position. Now, so this is the way it's really going well. It's stuck in this position, right? So now if I bring that down, so we know it's stuck in this position. So if let's say this hand, I'm on the sacrum, I'm going to, when it comes into flexion, so I'll just try and show you better. So it's going great that way. It's not going great that way. So what we'll do is with 5 grams of pressure, no more, the weight of a nickel, we're going to help push it and hold it and not let it come back. All right? So we're not going to let that come back. And what will happen is, eventually that will create a still point and a shudder. Right? I talked about before, like the feeling of a sneeze. And then you'll feel it. And then the craniosacral rhythm, it'll reset itself. Okay? So let's just go through that again. So it's going great in this position. So we want to, with the weight of a nickel, it's not going that way far enough. All right? So what we're going to do is directly put it there, but when it wants to return, don't let it. Okay, and I'll go through this as we go through the course. So that's one way, that's direct, all right? So goes great that way, doesn't go that way. We want it to get over to there, for example. So what we do, it gets to that position of restriction, don't let it come back. So if this was my hand that well, here's your sacrum, I'll put it like that. that's my hand that I've got here. So I'm using my fingertips to do that movement. And then just wait and don't let it come back. All right? So if it was there, it comes over. Boom, don't let it come back. And it's going to want to go back. Again, the lightest feather-light touch. And then what you'll feel is it will give up, hit a still point. So you've initiated a still point, and then the craniosacral will come back again, like I just talked about before, and you'll find that the movement should be much better. You might need to repeat it 1 or 2 times, 3 or 4 times perhaps, but that's what you're looking for, okay? So that's a direct method. The indirect method is to go to the point of least resistance, so it goes to there, and then hold it in that position, all right? So, and don't let it come back. So it goes right to the end point of its good range. You're not going to let it come back. And then the same thing, we get a shutter, a still point, and then you let it go. And you see how that movement is through there, all right? So that's a direct method. The direct method is pushing it into the area of resistance, okay? Again, 5 grams pressure, weight of a nickel, all right? The indirect method is when it gets to, if I showed you on my shoulder, right? Let's say I'm restricted here, I would be, the direct method would be stretching it towards that restricted way, okay? The other method was just let it go right the way, so my restriction is this way. Direct method is stretching it, if you will, right? Getting the joint to stretch that way. The opposite way is, which we do in manual therapy as well, is bringing it, shorten it, and then we get better range of motion, all right? Okay, so that's the direct and indirect method. I'm giving this to you now, but remember that's more advanced until you really feel those restrictions. At the moment, all I'm just really is just in that position is just, for the moment, as you begin, just feel for the therapeutic release, okay? Or the unwinding, or the still point, as just until you get better at that, all right? One other technique that you can do, okay, is to loosen up, is to give the slightest amount of inferior traction. So pulling the sacrum away from the L5, okay, to get better movement. So if you weren't happy with the movement, again, this is the lightest of pressure. This is not a drag, like nothing like that. It is the lightest of pressure. Now, so if I was to show like that, let's just say that we're pulling that down, pulling the sacrum away from that to get better movement between the sacrum and L5, okay? So I hope that's clear for you. So T position, okay? We can have the arm between the legs or come in through the side, which I'll show you. Still getting the T position, okay? And then we can wait for this is going to happen in all of these as we go along here. We're waiting for a therapeutic release. That is our goal. Remember, a therapeutic release of whatever that feels like, whether it's warmth, whether it's softening, whether it's a sigh, whether it's, it could be emotional. We might feel a still point as it resets. Might be unwinding we're feeling. And there might be no change because it didn't need a release, or you weren't feeling it just yet, okay? All right, but again, it'll all be, I'll be reinforcing this as we go through the next ones, okay? So if you're not quite sure about that direct, indirect, what was all that about, I'll keep going with you as we get through the course. So if you like this video, don't forget to subscribe, like, you can comment below, and also your resources. I've got fantastic deals with bundles of my online courses, whether it's aromatherapy, whether it's massage. You can have a look at that, and if you're interested, you can go along, click the links, and see if that's something you'd like to do.